Hi, I'm Suzy Fielders with TCT On Location. I am at Allergy Partners at the Piedmont. Today I am here with...
This is Joel Hartman. I'm one of the physicians here at Allergy Partners. I've been here, I guess, 14 or 15 years.
Oh, wow.
Yeah.
And I'm Ashleigh. I am Dr. Hartman's medical assistant. I've been here for 4 years.
I'm Angie Martin. I'm the practice manager, and I've been here for 16 years.
Wow, long term, all of you. This is what we do for skin testing for allergies, right? Can you tell us a little bit about what all of this is?
Yeah. So, when we have someone that comes in with allergy symptoms, foods, environmental allergies, seasonal allergies, what we really want to understand is kind of what their symptoms are and then be able to diagnose exactly what's causing their symptoms. And the way we do that is with allergy skin testing. So I thought it might be a cool idea for Ashleigh to kind of just demonstrate what she does. She can use my forearm for the testing, but we use something called Greer picks, which are, I don't know, Ashleigh, if you want to hold one of those up. One of these plastic devices that actually kind of introduces small amounts of allergen just under the epidermis, just under the first part of the skin. And it really does kind of feel like a little scratch on the back of the hand. It's not a needle. It doesn't hurt. If you're allergic, you'll itch. But I think on our podcast, Dr. McCann described it as prickles and tickles. And so I figure Ashleigh can just kind of show you what it looks like.
Yeah, I've had it done, and it doesn't hurt. The worst part is the itching when you're allergic.
Yeah, if you're really allergic, you may
That's
have
how
itching.
I was.
Yeah.
Yeah.
Do you want to show Ashleigh?
Yeah. So when you come in for your visit, after Dr. Hartman sees you, we will come in, clean your back off. You'll be in a gown. Your skin testing will go on your back. We number everything 1 through 84 total. And then if you look in the bottom of the tray, so the serum is basically filled up in these little pods here. And after numbering you, we pick up each individual and start scratching to your back. And it covers your trees, grasses, weeds, dust mites, cat, dog, cockroach, mold A and B.
Okay. And then how long does it usually take?
So about 15 minutes, we'll set a timer and come back and look. And when we come back in the room, we base your allergen off of your will and flare. So the welt that you have and then the redness around it.
And then there's a control, and that's everybody like kind of flares up right on that.
Yes. So you'll plan to itch with the histamine control. I tell everybody not to scratch. That's the toughest part is, staying busy for 15 minutes.
Especially little kids.
Yes.
I have two little kids. And
yes.
Yeah. So for the controls, we do 2 controls. So if you'll remember back like high school chemistry, whenever you do some sort of test or evaluation, you have controls. It kind of validates the test. So there's one control, which is a negative saline control. So that really shouldn't show anything on the skin. That kind of tells us that everything that we've done is proper. And then there's something called a histamine control, which really should be itchy and red. And that tells us that someone's skin is normal and that they're able to have a reaction if they're allergic.
All right, so Dr. Hartman is going to demonstrate this test for us.
Yeah, I'm going to let Ashleigh kind of show the folks at home kind of what this looks like. So that
how not painful it is.
And how not painful it is, and how really benign and easy it is to do and to have done. So Ashleigh.
Okay. I'm going to start by cleaning off the skin with the cotton ball that has alcohol.
And again, this is usually on your back.
So we do it on the back, but for folks who don't have a lot of things that we're testing, we'll sometimes use the forearms. So for instance, this morning we had someone and we were concerned that they had an allergy to a couple of different shellfish. So we just use their forearm.
Then I just mark the spot so I know exactly where I am placing the histamine and the negative saline control.
So positive is histamine, negative is saline.
Okay. And then in my panel here, it's labeled histamine. So I just pick that up and then you just scratch it to the area.
No screaming.
Negative control as well.
She's great, actually. No screaming at all. And really the whole concept is what you're trying to do is just at a very small and painless way is just introduce allergens just underneath the skin to where immune cells live so that if you're allergic, you can get a small allergic response without causing anything, more severe. So very easy, very quick. And the worst part is if you're really allergic, you'll itch a little bit. Do you want to show the multitask for kids?
Yes, absolutely. So this is our multi-test scoreboard is another name for it that we call. Same thing, trees, grasses, weeds, dust mites, cat, dog, mold A and B. It's a little bit easier instead of sticking an infant or a child 66 times or 84 times. It's just this little pod here. We place it in the container. We pick up the serum here for each individual environmental, place a drop there. Once we have the entire pod filled, we will pick up and then place to their back.
Do you want to do it on my forearm? Just show? Just show it's not painful. Ashleigh and I guarantee you we don't sit around and just like test each other and clean it. We're not.
So I like to I count down for the infant or child, and then we just make sure all of the individual pods touch the skin, and I may have to like rock back and forth side to side, but it's not painful at all.
And it's that quick. And she was doing it a little bit slower just to demonstrate kind of the technique. But I mean, that's pretty much it for skin testing.
Well, thank you for volunteering.
Yeah, no problem. I think I got to take the rest of the day off now. No.
Tell us a little bit about the treatments for food allergies, especially.
Yeah, thank you. So we have a really robust food allergy program at Allergy Partners, and we offer all sorts of food therapies for kids and adults who have food allergy. Most of the data from treating food allergy really comes from the pediatric population. So primarily, we treat kids who have food allergy. And one of the therapies that we offer is called sublingual, which is under the tongue drops. And essentially, this is what it looks like. Kind of a bottle that has a volume, and the dropper delivers really a precise volume of kind of liquid that contains a certain amount of food protein. So I think this one's for egg. So let's say, my kid has an egg allergy, and my goal is, listen, I want to really reduce the chances that my child goes out in the world and accidentally eats egg and has a reaction. Mm-hmm. So sublingual immunotherapy is one way that we can introduce very small amounts of food using just drops of that food, really microgram, 1/100th the amount of a normal, amount of food under the tongue daily. And over time, what it does is it basically increases the amount of food necessary to kind of cause a reaction. So to put that in perspective, let's say I have a child who it takes like 1/15th of a peanut to cause a reaction. After 2 to 3 years of using this daily, it may take upwards of 15 or 16 peanuts for them to have a reaction, meaning that if they were out in the real world and they went to a movie theater and they bought popcorn and they reached in and took a bite and it accidentally had peanut in it and they weren't aware, after a course of therapy with drops under the tongue, they shouldn't have a reaction. So it really does do very well at kind of increasing the dose that elicits a reaction. And it also really helps kids kind of live their life a little more anxiety-free.
Parents.
Yeah, and parents too, than trying to navigate these social situations where there may be a risk of accidental exposures.
Are there situations that people shouldn't get this treatment?
Yeah, so generally speaking, so question is about safety. This is probably one of the more safe forms of food therapy that we offer. I think that it's not for everybody, right? When we talk to parents and families about food allergy, we talk about all of the options, including avoiding. It's perfectly fine for folks to navigate food allergy by just avoiding those foods. In fact, that might be easier for some families than having to remember to do a dropper, of food every day. But when it comes to who absolutely isn't a candidate for sublingual immunotherapy, there's really only like one reason, and there is a very rare form of kind of food allergy which affects inflammation in the esophagus. It's called eosinophilic esophagitis, and it's not that common. I know it's a mouthful, EOE, and those would be kiddos that we probably wouldn't consider doing this therapy in, but it's a very uncommon condition.
How do you know if someone has that?
Yeah, so someone would have symptoms that include reflux, food getting stuck when they swallow, unexplained nausea and vomiting after eating. And those are questions that we ask before we start food therapy. And it's a quite uncommon disease process, but that would be the only thing that might hinder us offering this therapy to someone. So it doesn't happen all that often.
And this is something they do here, or do they take it home, or both?
Yeah. So the way we do our food therapy is you're in our office once for your first visit, where we kind of show you what to do. We give the drops, we monitor you, we make sure everything is fine and you're comfortable with the therapy, and then we release you to home to do the drops yourself at home. You start with a very dilute form of food allergy, and then every 8 weeks, the concentration of the vial goes up. And there are 4 different concentrations we work through. And what we do is when you get through one vial, we have you log on remotely and we do your next dose remotely while we watch you on camera, and we kind of do a visit that way, so folks don't have to come into the office but once. And then we see those patients back every 6 months to check in. We do monitor labs to make sure that they're responding to therapy, and they have access to us 24/7 if there are any problems.
How long do they do this for?
Yeah, so that's a good question. So when asked, it's pretty much a long-term therapy. So unlike therapies for like asthma or nose sprays for allergies, where you may use something seasonally or you may just use something as needed, this really should be looked at as something you're going to use for years. And the benefit in those instances can be great.
So lots of times, especially younger kids, grow out of allergies.
Yeah.
Does this kind of help? Do you think that helps us?
Yeah, so that's a really good question. And in the world of food allergy treatment, we're still pretty early in our understanding of kind of how kids are affected long term. So the question you ask is really about, can this therapy help you develop kind of a natural tolerance to food? So around 20 to 25% of kids outgrow peanut tree nut allergy, around 80 to 85% outgrow egg allergy. If you start this therapy early enough, maybe between ages of 1 and 4, there could be up to a 60% chance that those kids may outgrow the food allergy and it's not really a natural tolerance because it's something that we helped induce. But after 3 years of therapy, you may be able to stop and no longer avoid the food and have no symptoms with it. And the results really are kind of more robust the earlier you start therapy. Just as we get older, our immune systems become less plastic, less malleable. And for kids, we think with this therapy, kind of the sweet spot is somewhere between 1 and 4 years of age. But we certainly offer it beyond that. And there are kids even beyond 4, 5, 6, 7, 8 that can have that induced kind of responsiveness where they may be able to stop therapy and consume the foods and not have symptoms.
It's really cool.
That's our goal.
Oh, yeah. Can you tell us a little bit about how people go about getting an appointment? Do they need referrals?
Okay, no, they don't need a referral unless their insurance requires it, but most do not.
Okay.
Primary care physicians can send over a referral, but you can also just pick up the phone and give us a call.
What's the usual timeline? Is it hard? Like, does it take a while to get in for new patients? Or?
Really, it's according to whether they are on any type of antihistamine, because the testing, as you've seen, we need them to be off their antihistamines for that. So usually within 1 to 2 weeks, we can get them in.
And how long do they usually have to be off the antihistamine for testing?
About a week,
A week.
5 to 7 days.
Gotcha. So what would you tell people that are hesitant to make an appointment? Neither of you can chime in on this, because that fear or whatever.
Yeah. I mean, I think that there's certainly, for all of us, I think I mentioned this too in the podcast, doctors and lawyers create some of the most anxiety when we think about it, right? Even though I'm a physician, I go have my physical, there's always this degree of anxiety about what are they going to find today? What do I have to do? And I do think there's a natural component of anxiety involved in going to any new doctor's office. And I think that's normal. But I feel like what we do here with regards to testing is as bad as what you just saw, and nothing real, worse than that. And although it's absolutely expected for that to cause some degree of trepidation as you're thinking about your new visit appointment, we really do understand that. And we kind of take it very seriously. And we do our best to make people feel comfortable. If they have questions, we answer them. And really just to reassure them that, listen, if you're allergic, you may itch. None of this should be painful. And it will help us get answers to questions that you've been asking and really provide therapy to help your symptoms.
So tell me a little about your role of managing this place. This is a big operation, I feel like.
It is. So we have several clinical staff and clerical staff in our 4 locations. The providers generally have a satellite that they work in 1 day a week, and I'm managing those schedules and managing the staff and just making sure that they're seeing patients.
And where are the 4 locations?
We have Winston-Salem is our main location, and then we have Kernersville, North Wilkesboro, and Mount Airy.
Oh, it's definitely spread throughout the triad.
Yes.
Yeah. Is there anything you guys want to add or say to the audience about allergy?
Yeah. I mean, I think that it's one of the, allergies are one of the things that we think we all pass off as, I just live in, you mentioned it yourself. I live in North Carolina. I'm supposed to have allergies. And, when you think in the world of other health care issues, cardiovascular disease, cerebral vascular disease, that it really does seem like allergies probably not that big a deal. So I think all of us kind of sometimes just pass it off and we take over-the-counter medicines and we just keep adding medicines and it's not bad, it's not bad, it's not bad. But we know that allergies, nasal congestion, sneezing, itching, asthma symptoms really do have an impact. Food allergy have an impact on life, right?
Yeah.
Sleep, functioning, paying attention, feeling foggy during the day, shortness of breath. We avoid certain circumstances, perhaps picnics, family gatherings, church gatherings, birthday parties where there may be a food, swim meets where my asthma may act up because of our symptoms. And because it's so common and so many people suffer from these things, think about all of what folks may be missing out on. And we do offer forms of therapy that not only can treat symptoms, but in many instances may be able to cure them and fix them, where you're able to complete a course of therapy, come off of medicines, and have years of relief and get back to kind of doing the things that you want to do.
Well, thank you guys so much.
Yeah, thank you. Appreciate it. Thank you for coming and visiting Allergy Partners. Yeah.
Thank you.